Okay, hello everybody. Good morning. Thank you for being here. My name is Gina Capadu. I use she, her pronouns, and I get to be one of the program coordinators with Kids Mental Health Pierce County. Thank you so much for being here today. A special thank you to our friends at Newport Healthcare for presenting this webinar with Kids Mental Health Washington. We get to work with so many fabulous partners across the state that do fantastic work. So we're excited to uplift one of those partners and be able to share some information with you all today. So we're going to wait until 11 o'clock to get started right away. I'll give that introduction spiel again, but for those of you that are early, welcome. We're happy to have you. We'll go over our learning agenda. We're going to go over our introductions. We're going to turn it to our friends at Newport to share about their great programs across the state and the ways that they get to connect with you. We'll leave a little bit of time for Q&A at the end, and then we'll have a closeout survey. So that's what we have. So we're 11 o'clock right on the dot. Hi, everybody. I am Gina Capadu. I use she, her pronouns, and I get to be one of the program coordinators with Kids Mental Health Pierce County. We get to expand the program statewide as Kids Mental Health Washington, and I am very grateful to have our friends here from Newport Healthcare to be able to do a webinar today. We love uplifting the great work that's happening across the state, so we're very grateful to have one of those resources highlighted here today. So I'm going to jump on in. Thank you so much for being here. We've got a really full agenda, so we want to make sure we're maximizing that time. So let's get started. So first and foremost, happy to say that I get to facilitate this webinar, and here's some of our learning objectives for today. So for today, we really want you to walk away with an increased knowledge of just the care continuum that consists of youth behavioral health because it is so broad. We're also going to review some clinical and non-clinical supports available to kids, families, and partners. I want to make sure that you all get connected to your local teams, whether that's through Kids Mental Health Washington or our friends at Newport. And then we want to put you to work. So we want to identify some engagement opportunities so that we can do together. So with that, I just want to set the stage with a couple of group norms, just so that we all are coming to the space with some of the same values and understandings today. So one of the things that we really like to highlight at Kids Mental Health Pierce County is ways that we can collaborate and show up well for each other. So some of those things that I want to emphasize that we want to bring to this space today is please show love to the folks that are choosing to be vulnerable. So if you've got a question or if you have a thought, please do share those things in the chat, the Q&A. We want to hear from you. We also want to make sure that we're assuming good intent. I myself tend to be a chattier person, so I work harder on giving the ability to make space rather than take space. So if you're a little bit quieter, please step up, ask your questions, share your comments. And then also last, it's just okay to ask for context when you don't know what's going on. This is a space of learning, and we want to make sure that you get the information that you need or be able to get some more information by reaching out to our teams. So I know that we've got a few people coming from all over the place in different spaces and locations. What I would love to do is ask people to drop in the chat, even including our presenter friends here today, of what county or state are you coming from? What system or space are you representing? And then what are some of the biggest barriers that you are seeing when it comes to addressing care for youth behavioral health? So go ahead, drop those pieces in the chat of where you're coming from, your name, your organization, that system space that you are representing, and again, those biggest barriers that you're seeing from addressing care. So that's a little bit about who we are, what we're doing today. I just want to take a little bit of time to set the stage about youth behavioral health and then be able to also share about Kids Mental Health Washington. But really, one of the key pieces that we wanted to emphasize with our friends at Newport today is that we have to look at multiple factors that impact youth behavioral health because there's so much that youth are existing in. They're not existing in a silo, right? And because they're not existing in silos, it's going to take a multi-level approach of partnership and ways that we can support our kids and our families. And so we think about these pieces on the slides that have a role in how youth and their families and their communities are impacted. So you think about who they are as individual and singular people. You think about the context of their family and their natural support networks. We think about the community that all of us make up in a variety of different ways. And then we think about those more system level context pieces of the environment, of society. So that's really what this stage is about, but we also know that there's other intricacies, right? We have to think about our neurodiverse youth, our medically complex youth, those that have intellectual or developmental delays. We got to think about our friends in the rural areas. What does access look like to maybe a center of excellence or other resources? What's it like to navigate the insurance landscape? Or what are the availability of any resources, clinical or non-clinical, that are available to be offered or accessed by our families as well? What we do know is regardless of what kind of resources youth need for behavioral health, we all have to work together. We need to have cross-system partnerships to be able to serve our kids and our families because we're going to have multi-layers of impact, just like the last slide showed. So what we know is that it's going to take all of our partners working together because there is not a single system that can or should address every need of youth and our families. So what we really want to focus on is how are we able to have clear communication? How are we able to have access? And how are we able to find innovative ways to serve people with what we have while also building the stage of what we need and what that's going to be structured to be like? And those partners take up a really big domain of what it looks like. So some of them are listed here on the partners slide that we have. It's definitely not an exhaustive list, but what we want to do is leverage all of these resources, all of the assets, all of the networks to make sure that we're working together to serve kids and families. So one of the ways that we're doing this is we have taken the model that is Kids Mental Health Pierce County and went statewide, and it consists of a couple of pieces. And really what that is we want to have a space where anybody can request a reach source for youth that have behavioral health needs, regardless of where they live, what kind of need it is, and any other pieces that fall within that domain. Kids Mental Health Pierce County and now Kids Mental Health Washington as our statewide, which I'm going to articulate in just a bit, is really designed to support kids that are kindergarten through 12th grade, regardless of any insurance that they have or no insurance or dual insurance or something else, regardless of where they live as well and whatever the acuity is. And in order to do that, we accomplish that in a couple of ways. One, we provide direct behavioral health navigation and care coordination. A second thing that we do is we really value having local regionalized websites that have up-to-date local and community-based resources for kids and their families because we want information to be current and relevant. We also can bring youth and families together with partners in their community through what we call a multidisciplinary team meeting, where this is a very youth and family centered space where we provide wraparound collaboration with local resource partners to develop action plans that are tailored to the needs of the youth and or their caregivers. And last, we all have to be rowing in the same direction to make the most impact. So we have very diverse representation in our steering and action committees that are coordinating local resources and collaborating on community initiatives. These are the model components that make up Kids Mental Health Pierce County that has now went statewide. So we are now Kids Mental Health Washington. So with Kids Mental Health Washington, we take those pieces of Kids Mental Health Pierce County that I just articulated, and we have stood it up across 10 teams throughout Washington State. So we are now fully statewide, and we have done this in partnership with our friends at Developmental Disabilities Community Services and the Healthcare Authority. And really what this is the teams are taking this model and they are making it their own, so it's fitting their needs, their community, their cultures. So for information on how you can get connected towards those pieces of the Kids Mental Health Pierce County model, which is that behavioral health navigation and care coordination for any youth kindergarten through 12th grade, you're able to access that. Each of these teams have a local resource that they maintain of all the current events and information and partnerships in their area. They are convening those multidisciplinary team meetings where we get everybody together in a room and have a discussion that's tailored towards the needs of the kids and the caregivers, and they have their own steering committees working on hyper-local initiatives. So we do have those 10 teams statewide. This map is available on the Kids Mental Health Washington website, which I'm going to drop into the chat, and all you have to do is go to our homepage, click on the county that you're looking for resources in, and it'll take you to that local team. One of the things that I do want to articulate before I pass this over to our friends at Newport is this is done very intentionally with our friends at the Developmental Disabilities Community Services. We have DDCS partners that are dedicated specifically to Kids Mental Health Washington's program to be able to access how do I get information on what waivers a family qualifies for? How do we educate developmental disabilities community services staff about training opportunities or some of the great work that you're doing so that we can network? So really, we're really grateful at Kids Mental Health Washington to have a program that is now statewide with some fantastic partners and be able to articulate and highlight some of the partners across the state, like our good friends at Newport. So what I'm going to do is pass it over to our friend Ryan. They're going to tell you a little bit about their program, how to get connected, and then I will take it back from there. So Ryan, I turn it to you.
Perfect. Thank you so much, Gina. Can you all see the PowerPoint? Perfect. Thanks so much, Gina, for having us, and thank you everyone for being here today. We really appreciate your time. My name is Ryan. I'm a clinical outreach specialist with Newport Healthcare here in Washington State. And before I turn it over to our speakers today, who will be talking more about our Washington programs as well as our treatment modalities, I'm going to give a brief overview of our services that we provide nationwide. And if you have any questions, please feel free to leave them in the chat. We do have quite a few speakers today, so we'll try our best to answer any questions at the end of the presentation. But if we do run out of time, no worries. I think Gina has everyone's contact information, so we'll make sure to follow up with everyone afterwards to make sure that your questions are answered. All right, so let's get started. So for those who are not familiar with Newport Healthcare, we offer residential treatment programs as well as outpatient services to kids as young as 7 years old, teens and young adults up to 35 years old, struggling with high acuity mental health, mood and anxiety concerns, substance use disorders, as well as co-occurring disorders. We do have specialized OCD programs in California as well, with locations spread throughout the country, including over 90 programs across 12 states. And we do have programs locally here in Washington as well, which is what we'll be talking about today. While a client is in our care, they received an individualized treatment plan that includes an individual therapist, a family therapist, a counselor, psychiatrist for medication management, and a full treatment team to support their needs. We prioritize family therapy, utilizing attachment-based family therapy as one of our treatment modalities, which we'll be talking about today as well. We also support with experiential therapies such as art, yoga, music, outdoor therapy, and adventure therapy. I know in our Snohomish program, we have baby goats on site, which our clients really love. We also support with academic, executive functioning, and life skills so that clients can continue to grow when they leave our program. So these are the levels of care that we offer at Newport. Particularly in Washington State, we offer residential treatment programs, partial hospitalization programs, and intensive outpatient programs. We also support with discharge planning as well. So once an individual leaves our program, we help them find other services or continue working with professionals in the community. So it's really important for us to know the important work that you all do as well so that we can make the appropriate recommendations and referrals when needed. Our program is typically between 30 to 90 days, but it truly is case by case. And we work with most major commercial insurances. If we're not in network, we will try our best to do single case agreements, and we've had lots of success doing this. Unfortunately, at this time, we don't work with Medicaid. But if you do have an individual who has Medicaid insurance and they're looking for a particular program or maybe a higher level of care service, please reach out to me. I support with resource navigation, so I can provide you a list of programs that might be a more appropriate fit for that individual. And lastly, so at Newport, we have a local clinical outreach specialist in nearly every state in the US, which is my role. So I am your local clinical outreach specialist in Washington. And our clinical outreach team, we specialize in resource navigation, as I mentioned, for those who need a particular type of service or maybe a higher level of care service. And our goal is to be a resource for you, a resource for professionals and families. So if you if you have any questions, if you'd like to learn more about Newport, or if you just need resources, please reach out to me, and I'll be happy to help and support. Also, I wanted to mention that at Newport we offer complimentary CE events and webinars, and you can find more information at newporthealthcare.com/events. I'll also put the link in the chat. And also, we love connecting professionals to other professionals, and we host quite a bit of networking events across the state. And I know the kids mental health team, they've been to some of our events, and we've gone to some of their events. So if you like more information, I'm happy to provide you more. Please reach out to me anytime. All right, so that's all I have for today. Thank you again for being here. I'm going to pass it on to Dr. Tyler Lanny, who is the executive director of our residential treatment programs in Snohomish County and Kirkland.
Thank you, Ryan. Yeah, I'm Tyler. I'm a licensed clinical psychologist. I've been working in acute mental health care in Washington for almost 20 years now, and I've been with Newport Healthcare for over the past 5 years. Started out as a family therapist, and then have worked my way up the ladder to clinical director, and now executive director over our Kirkland adolescent residential site, and then our Snohomish young adult residential sites. I've really appreciated working with Newport, having all the resources that we have and being able to do the intensity of care, and really integrating ourselves into this model of care that or the resources that we have in Washington. This is kind of the footprint that Newport Healthcare has. We have our Port Townsend adolescent program, our Kirkland residential adolescent program, and also our Kirkland PHP. I'll have the directors of those programs speak shortly, and then also our young adult residential programs up in Snohomish. Next slide. This is a little bit of a preview of where we'll be talking about. You can go ahead and go to the next slide, Ryan. So really, this is about serving our community and the region that we're in. I think, as everyone on this call probably knows, mental health resources in Washington are really lacking. When Newport opened 5 years ago and providing residential care, it took a lot of work on Ryan's team to kind of help everybody understand that we weren't CLIP, that this was kind of a different form of residential. I want to spend a little time kind of talking about that, but we are really focused on being partners with everyone in the community. We have adapted more than I think many other sites in the nation, because again, Newport is national, to be managing high acuity and a variety of diagnoses, because that's who we work with. We probably have some of the highest acuity clients in the company, just because that we have some of the highest acuity of mental health problems in our state and in the region we serve. And really, I only see other partners in our region. Like, I don't see competitors, because we all need to work together to get these folks healthier, because for whatever reason, it just seems like our clients are getting sicker. And I really wish we were on our way to putting ourselves out of jobs, but we're really not, unfortunately. I want to make it clear that all our programs are voluntary treatment. Whether it's our adolescents or our young adults and adult clients, they have to consent fully to all aspects of treatment. They have to be signing themselves in, and all our buildings are unlocked. Again, in contrast to a CLIP program or other programs folks might be more familiar with, this is voluntary, and because of the age of consent for mental health treatment, the adolescents and youth, they too have the right to sign themselves out. Now, it's a little bit more complicated than that, but that is the bare bones. So, if folks aren't ready to receive treatment, we will work as a team to try to get them on board. And once they're in our doors, obviously, we're working for that change talk to kind of solidify. But that is just an important kind of piece of the work we're doing. It's also really unique that we can treat primary substance use and primary mental health and co-occurring disorders at all our sites in Washington. Thank you, Rachel Siebert, for doing that. She'll speak a little bit more about specifically our substance use work. But we don't have the ability to do detox, but we do partner with other local agency if detox is needed, and then working on getting them to any of our sites. And again, that's having that specialization again, it's just what's needed in our region. I also want to note that, we have a lot of LGBTQ plus youth and clients in our care. It actually makes up probably the majority of the folks who seek care for us. We really treat gender and sexual orientation as being on a continuum. And what location, while we have gender specific designations for our locations, I want to make it really clear that which programs folks seek out is based on client preference more than anything, and then based on their identified at birth sex or their gender identity. And the actual mix of clients we have at any given site is very diverse, and so those gender specific designations are a little bit of a misnomer. And then in terms of family therapy, Samantha will be talking about that even more, but I just wanted to give a shout out that that's really the Newport difference. And parent and guardian engagement is essentially a requirement. And because it's where we see the most amount of change, and particularly that change is that's sustainable. First thing we tell families is, you can't just send your kid here for us to fix them. You need to be doing the work too, because they are that part of changing the environment. All our youth are doing things for reasons. A lot of that has to do with their family system and the environment they're in. That family therapy is about having guardians and parents make change and changing the environment as much as possible. And it's a very common question about wait lists. Just broadly, we are generally very busy at all our sites. We're generally very full the vast majority of the year, but wait lists are generally measured in time in terms of days or weeks, not months. But that is very seasonal, and right now we don't have much of a wait list for just about anybody, but just so folks are aware that it's not impossible to get into us, but it is often a brief wait because we are busy. Next slide. So I wanted to speak a little bit more specifically about the sites I oversee. This is our Kirkland, again, identified adolescent female residential program. Next slide. Called Newport Academy, adolescent female, ages 13 to 18 plus. Really, we're licensed to be able to take basically any age past 13, but unless folks are still in high school, we're only admitting like 19 year olds is kind of the top. Otherwise, thankfully, we now have our young adult programs to send them to. We have 25 total beds. We've been open since April 2020. I want to walk through the photos a little bit. Sorry, I can go back one real quick, Brian. We have our lobby, a welcome area. Really, so much of having someone be successful in treatment is good first impressions. So that's where they're greeted and go through the admission process. And then the next photo under that is one of our group rooms with 25 individuals. We have them divided up into pods. They spend the majority of their day in one of our group rooms where we're doing CBT, DBT, ACT, process groups, substance use specialty groups, all sorts of different modalities, trying to find what's going to click for various clients. There's a photo of one of the bedrooms. And then the bottom right photo is of our art room, art therapy. All our clients are doing art therapy with a certified art therapist and licensed clinician twice a week. That is such a powerful modality. Ultimately, we want our clients to be able to verbalize and better understand their emotions, but sometimes writing or journaling or art is a way that they start understanding those emotions and build insight into them and get to the point where they can communicate to them. It's so amazing to see how much they flourish and develop those abilities through art. And then the last photo on the top right is one of our classrooms for our adolescent programs. They are doing essentially about 4 hours of education time while they're in residential. We have certified teachers who are communicating with their school teachers at home, or if the client youth is on doing online learning, getting them engaged in online learning. Lots of our youth do a lot of credit recovery, usually being able to do well in school is one of the first things to kind of go and decline when folks are struggling with severe mental health. So this is part of that healing journey and getting them back on track. And so much of our care is oriented around, hey, like we are just a 1 to 3 months. It's a pretty good chunk of time, right? But we're not curing everybody of everything, right? We might not be curing of them of anything, but we want to be setting them up with the resources and have the tools and have the supports in place so that they can hit the ground running, do that step down to the next level of care, and then just never need this acute level of care ever again. Because the work we do is intense. We're asking for a lot of change work from the adolescent and the family. But we want everyone healthier and more stable at the end of it. Okay, I'm gonna hand off to Michael for a little bit.
Thank you, Tyler. Hello, everyone. Such a pleasure to be with you. I'm Michael Tyers. I've been here at Newport a little over 3 years. And what attracted me as a licensed marriage family therapist to Newport, and then because of that, Port Townsend, really is the basis of the family work. And ABFT is a really strong evidence-based model. And rather than believing that we can magically wave a wand and fix kids, we instead look at healing families. And that means a lot of hard work. And we're very clear with parents at the outset. And of course, Samantha's going to talk in great detail about that model. But I'm just really, really pleased to be with you and to represent Newport Healthcare as an organization that so deeply is committed to changing families, helping them get over the ruptures that they've experienced between each other, helping them heal and get to a place where they don't need us. They might need other things, but hopefully not our level of care. So this is a picture of our actual campus. What the building you're seeing is actually our schoolhouse, where, as Tyler said, we all do education. For us, it's in the mornings. So the bottom floor is a larger group of 12 clients in one pod, and then upstairs is a pod of 8. So we're a 20-bed program, adolescents age 13 to 18 typically. We more and more have turned to Tyler and the young adult programs in Snohomish County for the 18 plus. We do still take some kids at 18 and more commonly kids who might be transitioning from their 17th to 18th birthday while they're here. We have a clinical profile that will be familiar to all of you, I'm sure. We see a lot of major depression, often recurrent, often severe. Right behind that, we tend to see a lot of PTSD and other trauma. We have begun this last year, as Tyler indicated, to do SUD primary. And for every time it's primary as a diagnosis, there's 5 or 6 times where it's a comorbidity with mental health as a primary. And then right behind it is the substance use issues. The family profile is families who've gotten to a point where they're just really struggling and know that their kids need something more than what has happened. And so we're always privileged that they reach out to us and that we have a chance to be an answer for families in crisis. And we see it that way. We don't think of a kid in crisis. Granted, that's true in most cases, but we really see it as a whole family who's desperately reaching out for help. Can't tell you the number of times I've begun by talking with a parent who's like, I'm so grateful that we have this opportunity to be here with you because we honestly don't know what else to do. So these tend to be families who are feeling really stuck. Some of the things that makes Port Townsend a little bit special is also, along with Tyler, the focus on client art expression, a whole different way to enter the soul and the psyche than talk therapy. We do a lot of EMDR. We do a lot of DBT, CBT, a very robust adventure experiential program. We are in the Olympic National Forest area, and so we take total advantage of that for beach and hike and hot, cold plunges and just a whole variety of things outside to help kids understand the beauty of nature and how they can interact with it. We have a running club 3 mornings a week. We have workout groups in early mornings on alternate days. We've done things like art galleries where the clients have a chance to show off their art. And it's so cool because that's done with academics and culinary and the art therapy person. And so kids get a chance to show off their stuff. And then we have people in uh, bow ties serving drinks as if it were an art gallery. They're tropical drinks, of course, as opposed to alcohol. But nonetheless, we try to make it fancy and give the kids a lot of kudos for being vulnerable and willing to share their artwork. We also have career fairs where the kids get a chance to experience how some of us, how we got into this field and what other work we've done in our lives. So 20 beds currently, working on an expansion to 26 beds. And we are considering specialty with those 6 beds. Could be OCD, could be kids on spectrum, could be LGBTQ plus. Could be a lot of things. And so if you have specific needs that you think we would be best to specialize in, please drop that idea into the chat. Have a very dedicated staff. Really grateful to be a part of this program where staff can come in at entry level, then go to school while they're working the floor, supervising kids, and then quite often flip over to clinical and become counselors and individual therapists and family therapists. So this is an opportunity not just for a job, but a career path. And I will stop there to make sure we leave plenty of time for others. Thank you so much.
And I'll move through this a little bit more quickly, but we also have our Newport Institute, which is our residential young adult branch of treatment that we do. We have our 2 new, relatively new buildings open. First, Railroad, adult female, ages 18 to 35, 6 total beds. We opened in July 2024. Just a beautiful location, really amazing views. It's hard not to just include those pictures there, but broadly very similar program. Michael, I appreciate you calling out EMDR. EMDR and trauma-focused CBT is a big part of the individual work that our clients are doing in addition to the family therapy. And then I also wanted to just shout out Newport really just supports really a holistic approach to care. We have lots of nursing engagement, psychiatry, dietitians, art therapy, and to really fuel this interdisciplinary team where we have a whole bunch of professionals. I find that I've always worked in inpatient settings because, well, I just like helping the folks who need the help the most, and that means high acuity. But also like being able to be in an environment where you have all these different perspectives and expertise, and being able to draw on each other's, experience to get the best quality of care you can for the youth that we're working with. Really fulfilling work, and we see amazing outcomes as well. And so this is Railroad, and then Echo Lake. Right up near Railroad, another just, basically a converted mansion into residential treatment. Next slide, another 6 beds. This is more of an all genders program. And it just opened December 2024, just at the beginning of this year, essentially. And again, that holistic approach to care. Each of our sites has, our residential sites has a gym, and even our our young adult programs. While we don't have school, we do have a learning lab, and they're in that 2 hours a day. If folks are still enrolled in school, they can work on assignments there, or work on refreshing their resume, or applying to jobs, or learning some life skills. So still some educational components, again, wanting to be taking that holistic approach to care. All right, I will hand it off to Cynthia to talk about our outpatient PHP and IOP programs.
Great, thank you, Tyler. Good morning, everyone. It's great to be here with you. Thanks for giving your time to allowing us showcase Newport. My name is Cynthia Morales. I'm the director of our outpatient services program. We're now kind of departing the residential realm and into our step-down care, into our partial hospitalization program, and our intensive outpatient programs. I've been with Newport Healthcare since 2020 in a variety of capacities, including family therapist, individual therapist, and clinician, associate clinical director now in my current role. I've had the pleasure of working closely with Dr. Laney when I was at residential. And I think one of the things that really stands out with Newport Healthcare in Washington is that we have a really close collaboration and partnership with all of our neighboring programs. And especially this is so critical for continuity of care. So of course in my program, we are taking adolescents from within the community, but we're also stepping down our teenagers from our neighboring residential program. So this demands really close contact, good coordination of care, communication with the treatment teams at both of our residential programs. So that way we're all on the same page and we're serving our adolescents the best way possible. So just to provide an overview of our program, we are serving adolescents ages 13 to 18, all genders, male and female, and we are part of this continuum, as I said before, offering trauma-based care, evidence-based practices. Really want to emphasize once again that in addition to our residential programs, we are also adopting the attachment-based family therapy modality, or ABFT, as a really critical component of our treatment program. We work within a multidisciplinary team, so we're working with our psychiatry team. We also have in our therapists, we incorporate music in our programming as well. Additionally, we have an academics component. So I think what's really important about those adolescents coming to our program is that the goal is really reintegration into their communities. So, if they were stepping down from the residential programs, if they were at the residential programs, rather, they were really focusing on safety, managing safety and risk behaviors. So now when they step down to our program, the goal is really for them to be able to now practice the skills that they've been learning, to really practice that outside of residential. We're Monday through Friday, 8 a.m. to 4 p.m. So they are going home at the end of the day. They're going home on the weekends, implementing their safety plans and working with their treatment team closely to ensure that they're making progress. So we're adopting a lot of the same modalities as our residential partners, including DBT, CBT, ACT. We also offer EMDR treatment at my program. We are also offering the experientials, as I mentioned before, yoga as well. And we are collaborating really closely. It's a really good partnership. We're a relatively small group of staff. We have a capacity of up to 24 adolescents for our PHP and then up to 12 for our IOP program. And I can hand it, I think now, one more slide. And then I definitely want to highlight that we have become primary substance use capable, which just means that in addition to taking clients who are presenting with primary mental health, we are now able to take those adolescents who are coming in with primary substance use disorders, which, as Michael had mentioned before, is often paired with comorbidity. And so we are working closely with our Washington substance use disorder supervisor, Rachel. She'll be right after me to talk more about our substance use programming. And then some other things that I like to touch on real quickly is that we do have this really great alumni network that extends past the treatment of the adolescents. It's a really great tight-knit network. They stay in contact with each other. They go and do events in the community. And so it's just a great way, I think, for them to continue to engage and stay connected with Newport. And then we're, of course, partnering with other agencies in the community local to us and beyond. So that way we are making sure we're giving access to care for adolescents in the surrounding communities. And that's it for me, turning it to Rachel.
Okay, hello everybody. My name is Rachel Siebert. I go by she, her pronouns. I oversee the 5 adolescent and young adult substance use treatment tracks here in Washington. My focus today is on how substance use fits into the bigger picture of youth wellness. We can move slides. When we talk about substance use in young people, it's never just about the substances. It's about what's underneath: the trauma, anxiety, depression, peer pressure, or the stress of unstable housing and family struggles. If we only treat the surface, we miss the chance to help youth truly heal. Focusing on the root causes allows us to address both prevention and long-term recovery. In Newport, what excites me the most is the strength of our internal resources. Within our substance use track, we've built a team that, excuse me, I'm going to cough. We've built a team that includes SUD professionals, therapists, and family specialists, all working together under one roof. Youth can move seamlessly from individual therapy to skill building groups while families receive education, excuse me, and guidance at the same time. We've added specialized SUD groups, integrated case consultation, and consistent counselor training so that no matter which door a client walks through, they're met with the same level of care. These resources allow us to keep treatment responsive and connected, and that's what truly changes outcomes. Substance use and mental health are deeply connected. Many of our young people are using substances to cope with depression, anxiety, or trauma, and untreated substance use makes mental health struggles even harder. That's why our work is not just about treatment, it's about integration. One of my passions is creating congruence across all 5 treatment tracks. When one site develops something that works, like a strong support group, we share it across all sites. We're building a system where each location strengthens the others. We can move slides. My vision is that no young person falls through the cracks because their needs are siloed. By addressing root causes, strengthening internal resources, and integrating substance use and mental health treatment, we can build healthier futures for our youth and families across Washington. Thanks. And I'm going to pass it over to Samantha.
Thanks, Rachel. Hi, everyone. My name is Samantha Quino. I'm the National Director of Family Therapy Services for Newport Healthcare. And similar to a few of my other presenters, I've been with Newport for quite a while. I've been with Newport for 9 years when we were just in Connecticut and California. So to be here with the Washington crew is just such a gift and also representative, right, of what we're seeing in our country, what we're seeing with our youth, and is really a response to, you can go back for a sec before we give away the next slide. One thing that I want to mention before we talk about ABFT is first gratitude for the other leaders who mentioned ABFT and introduced this, because we want family engagement. We want to make sure that every family that is coming to us, they're a part of the work that we're doing, right? It's not just like, here, take my kids, send them back to me when they're done. We want them to have healing and opportunity. So in addition to attachment-based family therapy and their weekly family therapy sessions, we also provide parent psychoeducational presentations biweekly, as well as parent support groups and caregiver support groups and specialized psychoeducation. So SUD, substance use, LGBTQ, eating disorders, and OCD, right? So along this continuum of care for our clients, we also want to make sure that we're actively engaging the parents and caregivers into everything that we're doing. Thanks, Ryan. So part of this is exactly what everyone's been talking about. Gina mentioned it at the very beginning. We're not siloed. We're all relational beings. And most often when an adolescent or young person is struggling, or when there's a community in crisis, which we're seeing, right, all the time, which we're seeing on the news constantly, the first questions that are asked are, where were the parents? What did they know? Were they doing anything? Did they have any idea that their loved one was struggling in this capacity, right? Why are they thinking that way? It's because of attachment, right? Because all of us are interconnected. Newport aims, right, to empower lives and restore families because we know that the family system is an integral part of the human experience because our attachment to one another, primarily our adolescents and young adults' attachment to their parents or caregivers, is what threads through their identity of themselves, their relationships with others, right? Their self-worth, and their internal resilience. So it's really important to consider that attachment. And that's why we want to actively engage parent and caregivers into our treatment process because we know that it matters. Now, this is not to say that we are blaming parents or that we're blaming caregivers. It's really about shared accountability, right? And so if we take a look at attachment-based family therapy, which we've been utilizing since 2018, we have worked with the model developers. We can take a look at the next slide, Ryan. We partner with the model developers and ABFT International. So Guy Diamond, Dr. Suzanne Levy, and Gary Diamond. Guy and Gary are not brothers. They just happen to share the same last name. We've been partnering with them as the first RTC to utilize this as our primary mode of family therapy. It has allowed us to actively engage the families in a whole new way. Now, as I mentioned, I've been with Newport before ABFT, and with now, we've always had a family therapy component. This just gives us this like extra edge, not only with caregivers, but also allows us to train and support our clinicians to give the best possible care to our families as well. And it doesn't hurt, right? Like we have a manual, we have the evidence base, we have all the research, right? So when we have some families that ask like, why do you want me involved? Why do I have to do this work? We've got some of that to back it up. Something that I want to stress about ABFT is that is attachment and relationship focused, right? We are not spending our time on behaviors. And so while this model uses structural and contextual family therapy, I want to focus on emotionally focused therapy. This is a very emotionally focused modality that the clinician and the family is going to be asked to be comfortable with deepening of emotion. We're not staying in behaviors, right? We are not staying hung up in all of those symptoms. We want to make sure that we get to the core connection and attachment or attachment ruptures that are happening for the family. Yeah, you can go to the next slide, Ryan. So a couple of things that we want to talk about in terms of ABFT is that it's like family therapy is equal opportunity hot seat, right? Like everybody is in family therapy and is going to be held accountable for their role in the system. And our role as the clinicians is to disrupt the patterns that no longer serve them. And one of those is not focusing on behaviors, right? So many of our clients are coming in as the identified patient and they're just seen as their worst days. That's not what we're focused on. We'll get there. Like we'll talk about behaviors at a certain point, but really primarily we want to understand the struggles and the connections and disconnections between the adolescent or young adult and their caregivers. So we are going to let the family know this, right? That we are staying in the emotion, we're staying in the connection, we're staying in the disconnections, and that we're going to move through the model. And here before you see the 5 different tasks. Task 1 is the relational reframe. This is a first family session. And in this session, it's really organic to what you'd probably do in a first family session, but we're highlighting strengths of the client and of the family. They're probably really good at fighting with one another. We want to remind them what they're fighting for. So in this first task, we're highlighting some of those strengths. We're understanding what is some of the mental health narrative that got them there. And then we want to understand the disconnect. So we're going to ask the client, when you're feeling suicidal, when you're feeling like you're going to self-harm, why don't you go to your parent for support? In that first session, we're just asking them to name it. We're not going to get into it in that moment. We just want it to take up space. I don't go to my parent because I'm worried my dad's going to get mad, or my mom has enough on her plate. I don't want to be an additional burden. right? So we want to name the attachment ruptures that have been happening and what's the barrier to going to them for support, and then asking them to engage in this treatment, right? This relational reframe is really, again, just to focus on their connection and the agreement to do so. Task 2 and task 3, you'll see, are a little bit separate because those are done with the client individually and with the parent individually. In that task 2 with the client, we're joining, we're getting their mental health narrative, but we're also looking for episodic memories. What are those concrete moments of missed opportunity that happened between the client and their parent? So we're going to prep them to talk about that with their parent, give them some emotional regulation skills, but also that emotional attunement, right? We talked about emotionally focused therapy. We want to hear about their pain, their anguish. We want to understand how it's impacted them, and not in this, I think a lot of teens and a lot of us, we get protective or like, oh yeah, he said that and it sucked, but I'm fine now, right? We want them to really be able to feel that emotion so that their parents have an opportunity to make it right, so that we are working towards repairing that attachment rupture. We're doing that with the client while simultaneously with the parent, we're doing a parent alliance. In these individual sessions, we're going to understand the parent stressors. Do they have other kids? Do they have any of their own mental health challenges? Are they co-parenting? Are they single parenting? Are there other family members in the home that have special needs or high needs? We want to understand the context of their parenting experience. We also are going to understand their multi-generational history. Because what we're trying to do in that task 3 is amplify their caregiver instinct, right? We're trying to bring that up so they can show up with their client in a different way. The last thing we're going to do in task 3 is emotion coaching. We really want to make sure that when these parents get a do-over, they're able to show up in a curious and not a critical way. Right? So all of this is like building this skill set and building this new story for how the family is going to connect. You've worked with the adolescent, you've worked with a parent, and then in task 4, we're repairing the attachment ruptures. So in this, the family gets the do-over. They get this moment of enactment that the adolescent can turn to their parents and say, when you said this or when you did this, it made me feel judged or criticized or hurt or unseen or unvalued, right? Or unlovable. And then the parent gets to respond in a way that leads to more conversation. It's not about apology, it's about accountability, right? To acknowledge how that has led to this disconnection. We do that as many times as it takes, right? So if however many sessions that takes is what we do. And then the final task is promoting autonomy. This is where we may be talking about some more of the behaviors, right? If the parents want to talk a little bit more about the substance use, because they now have context for their emotional experience, if they have been having risky behaviors or self-harm behaviors or socially isolating, they now can talk about those in a very new way because they have a secure attachment, right? That they've repaired those attachment ruptures, and that the adolescent and young adult believes their parents can handle difficult conversations, right? So really for all of the family system, we're just trying to prioritize their attachment to one another, the ability to have emotionally focused conversations, and to have difficult conversations in an emotionally regulated way. So that is ABFT in like a very brief little nutshell. If you would like to learn more, you can certainly get in touch with Ryan. As he mentioned at the beginning, we have a number of different CE events, and we often run attachment-based family therapy CE events, as well as all of our other ones. But it is, like everybody said, our family therapy component is something I feel very proud of, and I think definitely sets Newport apart in terms of healing the whole system and not just the identified patient. Thank you.
Thank you, Sam. Gina, it looks like we have about 8 minutes left. Is there anything you need to go over on your end, or should we jump right into Q&A?
I think we're good.
We're good? Okay, perfect. Well, thank you again, everyone, for being here, and thank you to Gina for having us, and thanks to the Newport team for being here. Looks like we have a few minutes and wanted to take this moment to answer any questions if there are any.
I have been keeping an eye in the chat. I haven't seen any in the chat quite yet, and then I haven't seen any come up in the Q&A, but I do want to encourage all of our attendees today that if you have a question, please utilize those resources so that we can answer those. I also want to put our friends at Newport on the spot to say that Ryan has generously offered to be the point of contact for any questions. So if you want to have any questions directly directed towards our Newport partners, I'll ask that Ryan puts his information in the chat so you can see it that way. So that's an opportunity to also continue to get more information. So not seeing any specific question. I'm going to go ahead.
I see a little bit of a theme, Gina, in folks' introductions. They were talking about barriers that I wanted to address. And please raise your hand if you have any questions. It seems like a lot of folks are, reflecting on the difficulty of communication and connecting with various providers. I just wanted to give Ryan a shout out, like as a clinical outreach specialist. That's really such an important part of his role is being that go-between, and it really is a priority of all our providers on site to be doing care coordination to get outside perspectives on families and adolescents, and then also to be doing warm handoffs back into services and be coordinating that discharge planning. So I hear y'all, and thank you for bringing that up. That really just again highlights how important that is to our partners and how much more we need to be doing that. Though Ryan bugs me about it a lot, but we can do even better.
I love it. And Tyler, I think you took it straight from my brain as well of, we covered so much in this webinar because, well, Newport does so much, but because those needs that were called out in the chat at the beginning about what are some of these barriers that you're seeing, they're complex and they're not a short list, right? So when you're thinking about rural access issues, insurance, wait lists, age limitations, communication, everything that was called out today, please do reach out to your partners at Newport, reach out to me at Kids Mental Health Washington. We don't have magic wand answers, unfortunately, but what can also be just as important as the outcome is how the intervention is handled. So doing it in partnership with compassion, with empathy, because there's a lot that we're up against, but there's also a lot that we can do together. So I just wanted to share that these slides are available. So if you would be interested in getting those slides, please drop your email information in the chat. I'll make sure that you get those, or you can reach out to Ryan or myself directly. We'll make sure that you get that. But since we did cover so much, I just wanted to go back to our original learning objectives and say that we really hope you walked away today with a couple of things. As one, we wanted to make sure that you learned about the range of resources that were shared on the care continuum. Tyler spoke to how some of the most acute youth are served. Cynthia talked about these step-down services, including the PHP and the IOP programs. We got to hear from Samantha and from others about just the different types of therapy modalities that are used, because we do love acronyms in this field. But we also talked about the clinical and non-clinical resources that are balanced there too, right? Ryan talked about goats and running clubs, and we've also heard about EMDR and all the other therapy types. So we just want to say there's a lot of information that's available. We also hope that you feel more confident in how to get connected towards our program. So Ryan's dropped his information in the chat. I'm going to drop mine here very shortly. What we would also really encourage you to do is utilize our website at Kids Mental Health Washington to learn how to get connected towards Newport and other resources, including many of the partners that are on this call today. I'm going to be dropping that in the chat. And just look at, of all the partners that you do work with, how can you reach out and see what's some new updates that they have to their programs, because we're constantly evolving, changing, growing, things are changing. And so think about how can you use the Kids Mental Health Washington website to learn about new resources. Get your resource posted so that people can get connected to you. What are some opportunities? You can reach out to our teams across the state to have a multidisciplinary team consultation, particularly if you've got a youth that has some complex needs, if there's multi-system involvement, just ways that we can get creative and network with others. And then please do reach out about some of those big initiatives that are coming and get engaged in our steering committee so that we in collaboration can focus on how we use the resources we do have to serve kids and families together. So I'm going to drop a couple things in the chat right now. and encourage you to please use our website, get connected. So I'm going to stop sharing, but I'm also going to invite you to do a very short, and I do mean very short, 2-minute evaluation with the power of AI. It is 2 minutes or less, just to let us know what you got out of this so we can continue to bring you content that is relevant and applicable to the work that you're doing. So I'm going to drop those two things in the chat right now. First link is our website at Kids Mental Health Washington. The second is an evaluation form. I do see that we have a couple of questions here in the chat. So Brooke, I see that you were asking about if there's plans to expand to serve Medicaid. And then I also saw that Christina asked about if families are in need of attachment therapies and have Medicaid, can they still reach out? We've got a couple minutes, so I'll turn it to Ryan to address those two pieces.
Yeah. If a family has Medicaid, they can definitely still reach out to me for resources. I spend a majority of my day doing resource navigation and helping families connect to appropriate programs and services. We also offer a free parent support group as part of our services that we offer, and this is open to all parents. They don't need to have a child in our care, and it's a great way to connect with other parents and share ideas and get support in that way as well. As far as expanding to Medicaid, this is my a dream of mine. I know it's we haven't had any luck yet, but I know this is something that our leadership is constantly reviewing. I would love to see it happen, and if there are any updates on our end, I will definitely let you all know. But at this time, unfortunately, we don't work with any medic. I don't know if any of the leaders here have any other ideas
I
or if they
mean,
have any updates.
all I would say is that Newport continues to want to be a leader in mental health treatment for young adults and adolescents and to continue to expand. And so there's not plans in the immediate future, but I hope that we continue to figure out how to highlight the essential parts of our programs and figure out how to streamline that more and more to get more and more access to a greater number of private insurances and even public insurances over time.
Great. Okay, I did take the liberty of volunteering Ryan to one of the questions in the chat here. So I just wanted to again thank you all for taking the time out of your day to be here with us today. Thank you to our Newport partners for all the work that you're doing and making space to share that information today. And if there's any other questions, comments, please do reach out to our partners. I have volunteered Ryan's information in the chat many a times, so I'm also going to drop my information here. And with that, thank you all so much. We appreciate you. This will be recorded and posted on the website for Kids Mental Health Washington as well. Thanks, everybody.
Thanks so much.